What is hormone-positive breast cancer? Dear friends, I'm Dr. Rajeev Vijayakumar, a consultant in medical oncology at BGS Gleneagles Global Hospitals, Bangalore. Today, let us discuss about what is hormone-positive breast cancer. Well, it is one of the subtypes of breast cancer. On the tumor cell, there are different receptors which we know of. One is called an estrogen receptor. Okay, so you can imagine a cell where you have a cell membrane, you have a cytoplasm, and then afterwards you have a nucleus. So in this cell, you have two types of receptors. One is a hormone receptor and a HER2 receptor. So in the hormone receptors, you have something called as an estrogen receptor and something called as a progesterone receptor. And then in the other type of receptors, it's called HER2, or it is a epidermal growth factor receptor. This would help in all of these actually give signal to the cell to increase in number and increase in size. So it gives something called as a proliferative signal, that is to increase its quantity and size. So what is this estrogen receptor and progesterone receptor? It is typically found on the nucleus of the cell, of the cancer cell. So the hormones which are produced in a woman, those are precisely estrogen and progesterone. They would act on the tumor cells and feed and help the tumor cells to grow. So is this hormone receptor positive breast cancer good, bad or ugly? It is considered to be one of the best forms of breast cancer. What am I telling? Best forms of breast cancer? Yes, because we have different subtypes. This is like probably if you see that if the Almighty tells you, hey, listen, I have to give you a breast cancer, you can choose which subtype you want. So the best subtype that we would go in for is a hormone receptor positive breast cancer, because these respond well to therapy, are not very aggressive, and they have a very slow and long course of treatment, and they have a very slow and long course of progression as well. Okay, so how is this hormone receptor positive or ER/PR positive breast cancer treated? If the tumor is small in size, if it's less than 4 to 5 centimeters, if there are no lymph nodes, then we can do a cancer recurrence risk scoring, like I had mentioned in my previous videos, like Oncotype DX, MammaPrint, EndoPredict or CanAssist. And if it comes as a low score, then we can offer only hormone therapy. Of course, after doing surgery, and if it is a breast conservation, we also add in radiation. If it is complete mastectomy, you do only surgery and hormone therapy in these patients. If the tumor is more than 5 centimeters, or if there are lymph nodes present, in this case, we first give some neoadjuvant chemotherapy. That is, chemotherapy in the form of around either 6 cycles or 8 cycles, depending on the patient and her comorbidities. After which, we shall go in for the surgery. And after the surgery is done, she will receive radiation. And then she will receive between 5 to 10 years of oral tablets. These tablets also, we have a different set of tablets for women who are premenopausal, where we give a drug called tamoxifen. And for ladies who are postmenopausal, we give a set of drugs called aromatase inhibitors. So the drugs there are anastrozole or letrozole. Sometimes even in women who are premenopausal, that is, they have not achieved menopause, in these ladies too, if there is a large node burden, that is, if the patient has had lymph nodes, then we consider this a clinically high risk. We suppress their hormones, that is, like I told you, estrogen and progesterone feed the tumor. So you need to cut it off. Where does it arise from? It arises from the ovaries. So you have to suppress the ovaries either using injections or using a surgery, that is removal of the ovaries. After doing this, you put the patient on aromatase inhibitors. So friends, so we have today we just learned a little bit about hormone positive, that is estrogen and progesterone receptor breast cancer, and how to treat it. If you like this video, I would request you to please press the like button, share, and then subscribe this channel. Thank you very much.